Thank you for joining us for this episode on childhood obesity, the warning signs and risk factors. This is the second episode in a 4-part series that's being sponsored by the Pottstown Area Health and Wellness Foundation. Joining us today is Dr. Lori Betts, Program Officer for the Pottstown Area Health and Wellness Foundation. Hello, Lori.
Hi, Marcia.
You and I had talked about childhood obesity. It's become a national epidemic. And the concern is that some parents, however, may be in denial that their children may be overweight or they may be obese. We hear things that they're just big boned or they'll grow out of it or it's just baby fat. And I think this is concerning. So I think we should talk about what are the warning signs that your child is considered to be obese or maybe on the path to obesity.
Sure. Well, baby fat is a normal part of development. All babies are supposed to have baby fat, and that's something that goes away as they grow older. Same thing with being big boned. People come in all different shapes and sizes, and there's small frames, large frames, and medium frames. That's all normal. What we are concerned about is having extra body fat. You'd think that just by common sense, the way to detect extra and too much body fat would be simply to check your child's appearance. However, there have been a lot of studies done on it, and research has shown that over 70% of parents of obese children did not recognize that their children were obese, and in fact, 50% of them thought they were underweight and were trying to get them to eat more. So apparently, for a lot of people, just the children's appearance is not going to be enough to tip them off. So a couple of other tips are, it's really in the waist. Is your child's belly bigger than other kids that are that height? Are they eating more than other kids their age who are the same height? Are they eating more than you? Is their portion size, way bigger than other kids that they're hanging around with? Are they eating and seem to be acting hungry right after everyone else has eaten and is no longer hungry? That may be a sign that they're eating for emotional reasons or that they don't know when it's time to stop eating and they're just eating because it tastes good. Another good tip is if children are in a husky or a big boy or a big girl size, the size number has to do with how tall and how large your child is, which is, normal stuff. But the husky and big boy, big girl clothes are really made specially for overweight and obese children. So that should be a tip. But, all these tips about appearance and waist, and there's such a variety in body types that the real best way to find out if your child's obese and check on their body fat is to check with your health professional. We have a tool called the BMI, which stands for Body Mass Index, which is very simple. It's just taking a person's height and their weight and plugging it into a little formula that then gives us a pretty good idea of whether or not there's excess body fat on the person. Your doctor, believe it or not, every time you go to your child's annual visit is actually already doing this, and they should have discussed it with you. But if you didn't catch it or if they failed to discuss it with you, please ask. They're always happy to discuss it. That's their job. And if your child is overweight or obese, they should be well equipped to help you with tips on better choices you can make and help you get on a plan or a program to help your child and help you educate yourself. There are lots and lots of numbers being thrown around about what's normal, what's good, what's bad, but let's just keep it really simple. If your child is at the 85th percentile, if your child's BMI or body mass index is at the 85th percentile or above, your child is definitely overweight. And if your child is at the 95th percentile or above of body mass index, your child is obese. So there are plenty of ways to tell, but the most important and most reliable way is to actually do some measuring. And for that, please always feel free to consult your health professional.
Your health professional.
Yeah.
Many of the risk factors of being an obese adult, they're fairly well known. We've got diabetes, heart disease, joint discomfort, high blood pressure, and even sleep apnea.
Sure.
These risks are also very real for children.
Right.
However, what are the other risk factors for overweight children that parents may not be aware of? And do any of these risks have even more of an overall and lasting impact when experienced by a child?
Marsha, I'm so glad you asked that because there's so much attention on the physical effects of the obesity. In fact, I've recently been speaking about how our children are not going to outlive us if we keep this up with the overweight and the obesity. But one thing I really don't think gets enough attention, and is very, very serious, are the emotional effects of being an overweight or obese child. We all have that stereotype of the jolly overweight person, but that simply isn't the case. Overweight kids are more likely to be teased. They're much more likely to be bullied. There's been tons of research, and overweight and obese kids have very low self-esteem and sometimes outright depression. They did a study that showed that kids who are overweight or obese honestly actually report that their quality of life is at the same level as reported by children who are dying of cancer.
Wow.
These children are truly suffering. In addition, these children are not able to participate and not able to do everything to keep up with their active or more normal weight friends because of their physical limitations. So they get more isolated, and that can cause them to have even lower self-esteem and more depression. There can be a vicious cycle, especially if a child is eating to cope emotionally with things they don't know how to cope with emotionally. Sometimes kids will reach to food to comfort themselves because they just don't know what to do with unpleasant feelings. So what you can end up with is a child who feels overweight and feels unattractive and has low self-esteem, and maybe they get teased, and then they reach for food to swallow those feelings or to cope with those feelings, which leads to more overweight and a worse problem, which then leads to more feelings of self-esteem and depression, and then you have an escalating cycle which never continues. So it's an extremely important issue that goes hand in hand with the physical sides of the consequences of overweight and obesity as well.
Absolutely. Well, thank you very much, Lori. To watch the entire 4-part series on childhood obesity, please log on to www.missionhealthyliving.org.